So do you know where you are?
Excuse me, visiting time's over now.
We've only just arrived.
I'm sorry, but as you can see, visiting time finishes at 8.
Oh.
We've got an agency nurse to take over. Okay.
We'll do that later. Right.
So because there was no guidance for the staff or no training for the agency staff, you know, you could on occasions walk onto the ward and see an agency nurse either reading a book or just not communicating with the patient. I mean, in the worst case scenario, the agency nurse or support worker is on the mobile phone, on Facebook or whatever, and the patient is just gazing into space.
It was just a policing situation rather than an interaction. And that was threatening, really. If somebody comes and sits next to you like this and watches you like a hawk, you feel threatened and you want to get away. Well, my husband, anyway, was like a frightened child or a wild animal because he didn't recognise his predicament. He knew he was in pain and he couldn't express it. He didn't know what was wrong and he didn't know what everybody wanted to do to him and why. He couldn't understand any of the explanations. And he just needed somebody to see, to reassure him that he was still alive, really.
There's patients who are our most vulnerable patients who need one-to-one care. So we have areas that have patients with anoxic brain injuries who've got cognitive problems who are high risk of injuring themselves. There's patients who have been assessed deemed high risk of falls, and in order to prevent them from harming themselves, they require one-to-one care or supervision.
We want family members and carers to be recognised, and we want to welcome them in and work in partnership to enhance delivery of care for that person with dementia, because I think it's really important that they share their expertise with us and we work in partnership with them to continue that care so we get better continuity of care.
They have little words that they use that wouldn't mean anything to the staff. That needs to be given to the staff so that they can find it easier to look after them and your loved one feels more at home.
We want to give holistic care, but we want to work in partnership with the relatives and the carers. So it's really important when a person comes in and they're assessed by the nursing staff on the ward that we get a history from the patient. We understand what their needs are. We can give you open visiting. Do you want to spend more time with your loved one, or do you want to even have a rota with all the family and the carers so you can be with them all the time? That's fine by us. Can we work in partnership with you? Can we come to some agreement how we can keep your relatives safe while they're in hospital?
It needs to be acknowledged that that the carers have a role to play.
Now it's changed, as in we've got a tool that we can work with. It feels more scientific and more professional.
It's a very simple flow chart that staff follow. It's colour coded, it's bright, it's very easy to follow, and it gives you example. If they're a low risk, it'll give you advice to say, talk to family first of all about them being involved in their care, put them in a bay where they're visible or a side room where they're visible. If they score an amber, they'll be in a bay with a nurse in there all the time, keep an eye on making sure they're safe. And then if it's red, they will have one-to-one care, which means somebody with them predominantly 24 hours a day to help them maintain their safety.
It does actually tell you that you've got to interact with patients and to get more out of the situation. It's therapeutic, it's caring, you're building a relationship with the patient. So we do games, we talk to families about what the likes and dislikes are.
Well, it's those light bulb moments. It's when we engage with somebody and they engage back, and you can see the change in their mood from maybe anxiety, from maybe feeling a little bit lost, to engaging and connecting with that person.
You know what the workload you've got, you can financially justify the means for it, so it's a lot less stressful. And I think it's good that the trust is recognising that and is taking part in it. And I feel that now when I do ask for help, it's there. It's not questioned. It's, if that's what the tool says, that's what I'm going to get. and it's very good, yeah.
The thing that's impressed me the most, as I mentioned, is my ward staff, our ward staff in East Lancashire have really embraced this change. They've thrown themselves 100% at it, especially my ward managers, my leaders. They have really shone to say this is something we want, and when you talk to the staff, it gives them something, a backbone to work from.